Hello, everyone, and we are so lucky today. We have Morrison Healthcare's Vice President of Nutrition and Wellness, Peggy O'Neill, with us here today. And she recently started her year of presidency with the Florida Academy of Nutrition and Dietetics. Welcome, Peggy.
Good morning. Thank you for having me today.
Yeah, thanks so much for being here and congrats on becoming the president of this cool association. There's more than 3,000 people in it, dietetics, nutrition professionals, but you've been a member since you were a freshman in college of this group. So how cool is that? How did that come about?
I guess ambitious as a student, and I had a really great teacher who said, if you really want to be part of the career, you have to, get involved, locally and statewide and nationally. So the first step we did in her class was sign up for the local association, and that's how I kind of got involved. So, and it kind of grew over the years into more love and passion for the profession.
Very cool. And
Mhm.
since the time that you were a freshman, those years in between, how would you say that kind of your career, but also just the field of dietetics has changed? Like maybe in people's perceptions, but also just in terms of like what you do?
Yeah, definitely. It's changed a lot. And I think it started early in my career with the Florida Academy of Nutrition and Dietetics when the Medical Nutrition Therapy or MNT bill was signed by then President Bill Clinton back in 2001. And it was, a lot of lobbying, educating, recruiting sponsorship from legislators from the state of Florida, and other affiliates did the same thing. So when it then all of a sudden, got passed through, it was like, oh my God, now, we're at the table. So it hasn't changed much since 2001, but there is a new bill on the floor, MNT bill of 2021. So 20 years later, hopefully we get to expand nutrition coverage that we can provide for Medicare Part B.
That's interesting. And that bill that you were talking about, the Medical Nutrition Therapy Act in 2001, 20 years ago, crazy that that was 20 years ago. Because I'm still thinking in my head when someone says 20 years ago, I'm like, okay, 1980. But it's like, no, that's not. But anyway, so that's interesting you say that was a turning point because it's in the name of the bill itself, medical nutrition therapy, like food as medicine. And that's something that I think it seems like it's been a little bit slower to catch on for like the food world at large. Like food is medicine. It's like people are realizing that now for sure, but it's obviously an idea that you guys have been trying to get across. So what's your biggest areas of focus now? Like what are you kind of most concerned with?
So, it kind of depends on which hat I'm wearing, right? So if I'm the vice president of nutrition and wellness for Morrison Healthcare, then we're really focusing on educating our dietitians to be, to perform at the top of their profession, but also to continue to look for added, for value that they bring. So in
Mhm.
Morrison Healthcare, we've really worked for the last few years on a comprehensive malnutrition program where we can do early detection and intervention and measure outcomes that are, positive for the patient and have healthcare savings, for our clients. When it comes to the Florida Academy, we're really focusing on advancing and protecting our Dietary Practice Act.
Right.
Dietitians in the state of Florida have to be licensed to practice. And from time to time, that gets kind of challenged.
Mhm.
Our goal is to make sure that the people in Florida have access to educated, evidence-based science, nutrition advice, because there's a lot on Google, there's a lot everywhere,
Mhm.
but nutrition can be very harmful if
Yeah.
it's not managed properly or doesn't align with the medical conditions that you're going through. So
Yeah.
safe nutrition advice is very important for us in the state of Florida.
Absolutely. And I think now more than ever, now that we have like so many like Facebook doctors that are, like experts in this or that, or maybe it's a pyramid scheme where I wanted to ask you this. This is a random question, but just popped into my head. There is this weird thing I saw where you put stickers like on your arms and it gives you like, have you seen that at all? Like,
I've seen a little bit of it. It's it's fun because every few years something new comes out. There's been blood testing or whatever.
like what on earth? Like maybe it
Um,
won't hurt, but it doesn't seem to me like it would do anything.
yeah. again, it's not science-based. It's not, when you test it and you get the same exact outcome time over time, then we can say, hey, this is something that's validated.
Yeah.
But I do find that over the past few years, there's been some neat things that are coming out. So they're doing like the saliva testing to see, what you're sensitive to based on your genetic makeup.
Mhm.
That's really cool. And some other blood tests and different things that you can look at genetically. How are you put together? Because, we're all from somewhere else, even if we don't live there. So your genetic background or makeup, I'm sure has impact on how you react to certain things in your environment and in your food. So it
Yeah.
is interesting
Yeah.
times.
And it's, I think definitely like groups of people, like sometimes like being lactose intolerant, for example, or something like that. I'm extremely lactose tolerant. Like I love cheese. I have
Yeah, that's
genetics
good.
from noon till night. Like, but other people that's going to make them sensitive. And I did the DNA test, the 23andMe, and
Yeah.
they identified a couple of things like that, where it's like you are less likely to think that cilantro tastes like soap. If you know what I mean, they can look at your genes. So do you think that's kind of like where the future of this is going, of nutrition, like very individualized?
Yeah. That's what we're seeing as well. And, Morrison Healthcare is part of, Compass Group North America. And as through Compass Group, we have partnerships with different vendors who do this type of testing, for nutrigenomics, we call it. And it's really cool. It's very interesting. And I think it will be part of where we're going in the future with nutrition and wellness.
That is interesting. It seems like because people like everything very customized to them, and it sort of it fits in with like what people are liking right
Mhm.
now, definitely.
Yeah.
And also, I noticed, just doing a little bit of background research on you, that you are a gerontological nutritionist. Is that right? And
Yes. Yes.
I have such an interest in senior dining and dining with dignity and that kind of stuff. And you had mentioned earlier about sort of like malnutrition, like because I know that getting calories into the elderly folks is really important. So I wondered if you could talk a little bit about that area of your expertise.
Yeah, absolutely. I started early in my career in gerontology and geriatrics. I worked at a nursing facility, and then even in my graduate work, I worked at the Center for Nutrition and Aging, and worked with a professor that was very well versed, and sort of that was her area of expertise. So, kind of formed a passion for it early on in career. Then started working in it. Really loved it. And how I utilize it now, because now I'm really representing more of the acute care
Right.
side of healthcare, is that those elderly patients do come into our hospitals, and oftentimes, depending on what the environment is at home, access to food, money, transportation, or even just dealing with chronic medical conditions,
Yeah.
over time they form malnutrition. Almost half of all the patients admitted have some form of malnutrition, mild, moderate, or severe.
Okay.
So what we're doing is finding early identifiers to find, really identify them early on. And it could be just a screening on admission and a malnutrition screening tool, but it could also be the dietitian doing a nutrition focused physical exam, because just looking at or listening to history, recording it, self-reported, is a little different from actually seeing the patient, asking them questions, touching them, looking for physical signs of malnutrition. And then that early intervention, there's a ton of research out there. As soon as we identify, we start, making sure they're eating
Mhm.
what they need to be eating, maybe supplement the food so that the extra calories and protein come in. And then with our program, we measure, okay, what's the impact? Are they staying longer or shorter in the hospital? What's the readmission rate? What's the risk of falling? Because that also plays the weakness plays a big role into how they are able to maneuver around and then fall and break a hip. And then it's that vicious cycle that they get stuck in.
That's the thing. Yep.
Yeah. And
Mhm.
it's also a good collaboration with nurses and physicians to really address it collectively, because that's how you really, it's not just a nutrition issue. Really, everybody needs to understand what the impact of malnutrition is for that patient and how do we address it together. So it's been a
Mhm.
great program so far, a good success.
Yeah, I like that holistic idea, and I definitely have heard a little bit about that before of the sort of way to detect this. And what are some of the questions? I'm just curious as to what you ask them. Are you just kind of like, "What do you have for breakfast every day?" And they're like, "Nothing," or like, how? What are some of the things you ask?
Yeah, and I think dietitians get really over time really good at asking for specific questions because it's not just what did you have for breakfast. Sometimes they wake up very early or they wake up very late, so it's not technically breakfast. So
Mhm.
we really get skilled in the art of interviewing, and so we look for things like what's the first thing you drank, what's the first thing you ate, how much of it did you eat? Just because you had a whole sandwich didn't mean to eat it all.
Yeah. Yeah.
So it's really the technique over time to
Mhm.
find what people really are doing at home, and what we think is normal breakfast, lunch, and dinner is not normal for everybody. So being unbiased, open-minded, and asking, good questions like what really was on your plate, and did you eat all of it? And
Mhm.
how often do you get that meal? Is it, once in a while? Is it every day? So it's really interviewing skills that you develop over time.
Well, and for all patients, not just seniors, it seems like enabling them, like putting on your Morrison hat, getting people to eat just in general something healthy. It has to be something that they like too. So
Yeah.
this is where, like, how do you work with chefs to sort of
Oh,
say, like, I want this to be healthy, but
yeah.
I want it to be awesome too. So how do you kind
Yeah.
of work with them?
It's a very instrumental relationship, and it comes from the top down. So our VP of culinary, Chef Carrie Neff, and I work very closely together, and our teams work very closely together. And the message is that the teams at the local level work very closely together. And I feel we've done a very a great job at doing that, at communicating that. A lot of the communication comes from both of us because you can't have food without nutrition. There's nutrition without food. So not every food can just come in a pill, even though that's what they think in the future, but it really doesn't. And the impact of food on your body and your mental and physical status is so different from just nutrition. So we make a collaborative effort to make sure that we start with the chef. The chef creates the meal. They say this is what would be, great to pair, to do, whatever, display. And then we start saying, okay, well, this is within the parameters of the nutrition guidelines for this particular diet, or maybe it isn't, and we work together and adjust. Because it's hard for a dietitian to say, well, we should offer all of these foods, just to make the nutrition check off. So it doesn't really work that way. It really has to start with the food first, and then we modify and say, okay, how can we reduce a little sodium in this particular meal item or this particular, day? And then we work together, and we have, very strong relationships to make sure that, again, it trickles from the top down, and it's been very, very successful, partnership for us for the past 10 years or so.
Yeah, and when I first started at this job, like more than 10 years ago, Carrie Neff was one of the first people who
Mhm.
I met in this field. And I
Yeah.
think I reminded him of that recently. And I made him feel old. He said, because I was like, that was way back and whatever. And he's like, I feel old now. But like, he was like on the forefront of doing things that were like a limited number of calories, but were still like your complete lunch. Like that was a concept.
Yeah.
And just super cool. It's like they just the things of it all coming together, I guess, is what I think the interesting part is. So, and wellness as something that you can get from food. So I wanted to see, do you have any predictions of like what do you think like are going to be some new ingredients or flavors or things of food?
Yeah, I wish I had that crystal ball,
I
right?
know.
But here's a trend that I see, and I think we see it in retail, and it's going to translate into patient dining as well. And that's clean label, whole foods as much as possible. So I feel we're really moving away from processed foods. People are reading labels. They want clean food, clean labels, no artificial whatever. And it's shaping the industry. It's what we buy in retail. It's what ultimately gets to be on our plate for our patients, our patients, and even especially like little patients, right? Pediatrics. The parents are very concerned about allergies and artificial ingredients. And so my prediction is that it's going to get cleaner and cleaner, which is I feel is like the opposite of the 1960s and 70s. Everything became about convenience, right? And so they process it.
it was like better
I-
living through science. Like it has
yes,
that's
yeah,
isn't it? It must be better for you. And that's why
yeah.
a lot of moms stop breastfeeding because doctors told them the formula is better. We know what, and just
Minute, how much you get.
it's
Yeah,
so
yeah.
weird the way that
It's
happens.
weird.
But
Yeah. But I'm seeing a turning point. I'm seeing that we're now saying, okay, we'll take convenience, but it can't be, taking away the quality or producing a food that may end up being harmful without us really knowing it, thinking, oh, this is a great product. So that's what I'm seeing changing. And I'm seeing a lot of plant forward foods, less meat staples and more plant-based foods.
And
Those
there's
are my two predictions
amazing
because
things.
that's a trend. Yeah.
And like talking about it to somebody who just isn't really in the food. I'm thinking of my dad. I was like, well, there is this fake chicken. He was just like, oh no, I'm sure it's horrible, but it's not. It's so good. It's like, and it shreds like chicken, and and vegan cheese is getting better too. So I mean,
Yeah.
people are working on this because they know that people want it. So that's
Yeah.
goes definitely. And anything else that you wanted to share with our viewers today? Anything new on the horizon that you're looking forward to, or something fun?
Yeah. I'm really looking forward to kind of re-engaging with a membership for the Florida Academy. It's
Yeah,
throughout the pandemic, we haven't been able to really see each other.
like in-person meetings.
Yeah, so we haven't had an in-person meeting. Our mother organization, the Academy of Nutrition and Dietetics, is holding their annual meeting in Orlando for the first time live again
Yeah.
in October of 2022. So we're definitely putting a member reception together right around that same event so we could reconnect with our membership because it's great to do things virtually. It really does help facilitate some efficiencies, but that one-on-one, that person-to-person communication can't be replaced. So I'm
And
looking forward to that.
especially for a food and drink oriented kind of, and
Yeah.
eating together and breaking bread together.
Yeah.
Absolutely. Very cool. Well, I am going to stay in touch with you. I'm definitely want to see what happens, and I've got more questions for you, but we're just about at our time. So thank you so much for being here with us today. Appreciate it.
Thank you, Tara. Thank you for having me.